Are you preparing for NCLEX? My name is Regina Callion, MSN RN, and I'm going to teach you the best ways to prioritize patients for your NCLEX exam. So the first way you may know is airway, breathing, circulation, A, B, C, and then D. I always include the D because D stands for decreased level of consciousness. Those are the top ways. If you are given 4 patients, 5 patients, you want to go to the patient with the airway problem first, then breathing, circulation next, and then decreased level of consciousness. The second way to approach a prioritization question for NCLEX is literally who's going to die first. So if you have a patient who has breathing difficulties, or you have a patient that has a gunshot wound to the arm, who's going to die first? The patient with the breathing problems. Or if you have a patient who is reporting pain, or you have a patient who is showing a poor gag reflex, who would die first? It's not going to be the gunshot wound to the arm. That's a circulation problem. It's going to be the person who is unable to gag or who's unable to swallow. So prioritize that as well. The third way is Maslow's hierarchy of needs, meaning that the foundational things that you need to live, food, water, shelter, those are going to be the priority over psychosocial issues. So you may have a patient who has diarrhea, right? A person who has diarrhea, and you have another patient who is who is grieving the loss of a spouse. Well, the person who has diarrhea is going to be your priority because they're experiencing what? Water loss. And so some nursing students, they totally overlook the patient with diarrhea or the patient who is nausea and vomiting because they're looking for a more serious condition. But for NCLEX, diarrhea is a serious condition because you're losing water, which is very important for you to live. The fourth way is time, meaning that if a person has a timed procedure in comparison to a person that doesn't, and that could be a surgery, a medication, you want to see that patient first. And then also isolation. Isolation is another way to teach because if I have a patient that is on universal precautions and another patient that is on contact precautions, I need to see the patient who is essentially cleaner than the patient who has an infectious disease. So those are my top ways to prioritize clients for NCLEX. Follow me for more.